Welcome back. It's Wellness Central this time, and today we are talking about an issue that affects millions of men, like Judith said from before, worldwide, not just here in Nigeria, but is often shrouded in silence, especially in more conservative societies like Nigeria. It's called erectile dysfunction. Now, according to Yale Medicine, ED is the persistent difficulty in achieving or maintaining an erection sufficient for satisfactory sexual performance. While it may be linked to physical causes such as cardiovascular diseases or diabetes, in many places like in Nigeria, cultural beliefs, superstition, and also even religious notions make this topic difficult to discuss openly, leaving many men without proper treatment.
Hence why there's so many bitters that are being sold. The condition isn't just about physical health, by the way. It's tied to emotional well-being, self-esteem, as well as relationships. However, advancement in medical science have brought about effective treatments ranging from lifestyle changes and medication also to therapy. Now, still in countries like Nigeria, myths surrounding erectile dysfunction remain widespread, with people often turning to unproven remedies or attempting or attributing the condition to supernatural causes. Again, why beaters are being sold. So today we aim to unpack the cultural, psychological, and medical aspects of erectile dysfunction, bringing more awareness to a condition that deserves open and informed conversations.
Yes, so joining us for this vital discussion is Dr. Yusuf Haroun, medical doctor and founder of the Love of Health organization. Dr. Yusuf, thank you very much for being with us. And let's go straight to it. In Nigeria, we know that there's so much to consider when it comes to this topic. Now, what are some of the most common misconceptions and even superstitions about erectile dysfunction that you've encountered in your journey in medicine?
Thank you very much for this opportunity to talk about erectile dysfunction.
You're welcome.
One of the most common misconceptions, particularly in Africa, is that erectile dysfunction is due to the problem of the woman. So in Africa, we blame women for everything, and this is a misconception. So the man might blame her for not having proper erection, and this causes depression again in the relationship. Another misconception is what you talked about when you were doing the introduction, and that is traditional or spiritual attacks. Many Africans always believe that erectile dysfunction is due to their family or their village people affecting them, which is another misconception. Finally, a misconception many people have, which I talked about extensively, is that people think erectile dysfunction only occurs to men in their old age. So these are the three main misconceptions people have about erectile dysfunction.
Interesting. Can we look at the cultural reluctance to discuss this issue now? What role does religion play when it comes to erectile dysfunction? The reluctance of people to willingly tell that, oh, I have a problem and I need medical help.
Yes. Now, if we look at Africa compared to the US, where I practice and I work, Africa is too religious, even more religious than even the Pope, or more religious than even the people who brought the religion. What I mean is that anything that happens to us, we feel it is either the devil or Satan that caused it, or it is God that inflicted it. But we don't look at the underlying cause by ourselves. Let me give you a quick example. There is a particular man who is in his 40s, and he cannot move close to his wife because he's having erectile dysfunction. So what he believes is that by his own religious beliefs, his wife is having infidelity, and that's why he cannot get close to her. So these are just part of the misconceptions we have about erectile dysfunction, and these are part of the problems people misconstrue about the religion. They believe, oh, it is maybe the cause of the devil, or it is a God that caused this on them. So religion has played a major effect on people's psyche about erectile dysfunction.
And it makes us wonder about, you know, stigmatization as well. Do you think that the reluctancy to talk, besides just religion, also has to do with stigmatization and how pop culture and, you know, social conditioning has made men cover themselves and shroud or just shun away conversations like this?
Yes, this is a good example now. Many women in Africa believe that their religion shouldn't allow them to express their sexual desires. It is usually considered as a taboo. So if a woman comes out to tell her husband that, okay, we've been married for years and you are not meeting up sexually as a man, the religious perception is that the woman is promiscuous or probably she has been sleeping out. So this is a religious effect some people have in their marriage about erectile dysfunction.
Dr.
Another example is, yes, go ahead, please.
I was actually going to ask, because we are running out of time, let's get to the symptoms. Let's get to the real factors that cause erectile dysfunction before we talk about treatment. What are the factors that actually cause it?
There are three main factors that cause erectile dysfunction. Number one, it's medical. Examples include diabetes, hypertension. You also have vascular disease and all other associated medical conditions. It can cause a man to have obesity, can cause it. Number two is lifestyle. Excessive alcohol intake, smoking, excessive consumption of unhealthy food. All this also lifestyle activities. Sedentary lifestyle, that is somebody, a man who is not active, sitting down in his office 10 hours, not working, is likely to develop erectile dysfunction. Then if we look at age, age also has a role. I'm going to say this, which is very important. I want our viewers to take this home. At the age of 40, about 40% of men develop erectile dysfunction. At the age of 70, about 70% of men develop erectile dysfunction. So you can say that most men at one point in their life would develop this condition. Finally, psychological factors also, such as depression, anxiety, and relationship discordance. For example, if a man and a woman are already having relationship issues, if they want to have sex, there's a most likely possibility that the man may not develop full erection. Also, there's a great possibility that the woman will not be sexually attracted to the man at that moment because of their emotional imbalance and their relationship disagreements. So she might not even be aroused. She might not be wet enough to even facilitate the man to have adequate penetration and for both of them to enjoy copulation.
It makes me wonder, besides just a lack of erection, is there any other symptoms that one would want to be looking out for, you know, just to know?
Yes. One of the symptoms you look at is the duration. There is a chart that the average sex should last, average for the first, should last between 2 to 7 minutes, average. We're not talking about the foreplay. Foreplay could last longer. Some people can have a foreplay for 20 minutes before penetration. But once there's penetration, it should be average of 2 to 7 minutes, which is called adequate. Some men could go 10 minutes. But if one of the symptoms, like you asked, is if a man who has normally been having good erection with his woman for duration of 2 to 7 minutes before he ejaculates, is now having just 1 minute or 30 seconds, then the man and the woman have to be worried that there's a problem. And this is one of the symptoms of erectile dysfunction.
Doctor, do you think the
quick ejaculation?
Do you think that because of
now there's a difference, please. There's a difference between.
Go ahead. You wanted to make a difference. You wanted to put the distinctions.
There is a major difference between premature ejaculation and erectile dysfunction. They are different.
Right.
Premature ejaculation, erectile dysfunction are different.
Okay.
So we have to understand.
All right.
Impotence is erectile dysfunction. Premature ejaculation is a different one entirely.
So when he's excited, he might have a premature ejaculation?
Exactly. Now,
gotcha.
the main difference is premature is where normally a man should have sex with his woman, and it should last, like I said, 2 to 7 minutes before he ejaculates, before he releases the seminal fluid. So if a man, there are some men, I'll give you an example, a man, even while he's having foreplay with his woman, before he even penetrates her, he's already ejaculating. That is premature ejaculation. Or once he penetrates her, in less than a minute, he already ejaculates. That's premature. So, erectile dysfunction is when even the manhood is not strong enough to last long, between 2 to 7 minutes. It gets soft.
Yeah, I'm glad we're having this conversation about the distinctions between the two, because we've seen the sales of this substitute alternatives of aphrodisiacs with the names bitters on top, and as well as the locally, you know, fabricated and brewed ones like Agbo, I don't know how to say it.
You know the names,
but you know the names.
Agbo Jedis.
Agbo Jedis, yeah, exactly. They're being sold. So is it because of premature ejaculation or just a lack of...
Is it effective?
Should they even be buying it in the first place? You know, what are the effects, the side effects of all of this type of off-the-counter drugs?
Yeah, this is a very beautiful question. As a medical professional, most of our drugs are extracted from herbs and trees. A good example is sildenafil, which is popularly known as Viagra, the blue pill that men use. It was coincidentally discovered by a woman in Europe, and I believe it's in London, while she was even trying to treat a heart condition for a man. She then noticed that the man's erection became very hard. And that is how it was. So I don't just discountenance those using aphrodisiacs. My only problem is that there should be measurement. I saw a patient who came to the hospital and was rushed to the emergency. He used this kind of aphrodisiac, and the person who gave him didn't measure it. So we usually have dosage. So he used excessive one because he wanted to satisfy his woman, and he developed what is called priapism. Priapism is the opposite of erectile dysfunction. Priapism is what some patients with sickle cell disease have. Priapism means that the man's erection may last for 2 hours, 10 hours. So about the aphrodisiacs and the agbo, my own recommendation is that they can bring their plants, let it to be scientifically studied, let there be research on it, let there be dosage and pharmacological studies on this kind of agbos or aphrodisiacs.
All right, doctor, real quick, before we end, we need to talk about prevention and maybe even treatment. Can you give us any hopes on that one?
Yes. Now, the first thing is to treat the underlying cause. In anything in medicine, treat the underlying cause. For example, if a man is having erectile dysfunction as a result of a medical condition, a good number of men have heart disease, which they don't know. It could be diabetes. If the glucose, something called hyperglycemia, if the glucose level in the bloodstream is too high, the man may develop erectile dysfunction. That's diabetes. Well, our fathers and our mothers will tell us, oh, don't take too much sugar. It's not that sugar directly causes erectile dysfunction. But if somebody has diabetes, there's something called microvascular complications and macrovascular complications. It's a topic for another day. So treat the underlying cause. Diabetes, hypertension, heart disease, treat whatever condition is having. Number two, again, is stop smoking. Smoking can also cause erectile dysfunction. Alcohol also, cease it or stop it. Number three, again, improving exercise. Men that perform exercise have a tendency to last longer in bed also. Because if you are running for 30 minutes a day, you most likely, because even sex is also an exercise, because after performing the act, the man in particular tends to breathe faster and his heart improves, his heartbeat increases. So treat the underlying condition. Finally, about the emotional, I said there are three main factors: physical, medical, and emotional. The emotional one, try to see a counselor if you and your spouse cannot solve the problem. see a psychologist, see a therapist, see a sex professional, sex expert. Add spice to your sex life. Maybe it's just one position you are doing which is boring and is not. Add more things to it. Improve your sexual interaction. Definitely this problem will be solved.
Well, there you have it. Improve your sexual interactions and side attractions. Anyway, Doctor, thank you so much for coming on. We appreciate you for doing this.
What a conversation for a Sunday morning. Totally enjoyed it.
Well, that was your choice.
Thank you, Doctor.